Excess glucose is stored in the liver in the form of glycogen. So when glycogen storage are maxed out, insulin helps the liver to convert glucose to triglycerides. Triglycerides is a lipid that is found in the blood, just like cholesterol. So your triglycerides will go up if you eat a lot of carbohydrates. Your digestive system converts carbohydrates to glucose, and the glucose finds its way to the liver and is used for energy. And as I explained, the excess glucose is stored in glycogen, but when the glycogen storage is maxed out, the glucose is stored in triglycerides, and triglycerides is transported all over the body, and it finds its way as stored fat, especially around organs. Insulin can be viewed as the key that opens the cell door as well to let glucose into the cell. Insulin assists in many places in the body. It also assists in the kidneys. It helps to regulate the uric acid retention and the salt retention. It controls a hormone, aldosterone, and that mechanism upregulates the salt retention on your kidneys. And the same happens with the uric acid. Because of insulin resistance, the mechanism in the kidneys upregulates and too much uric acid is retained. That's why with the carnivore diet, you cannot have high triglycerides because you don't have high glucose. There are some instances when you can experience a little bit higher glucose levels if you have illness or infection, or if you are exercising, or perhaps with the dawn effect. I have a video about that. But those are the extreme cases where your body needs glucose. So our bodies can produce glucose from protein. It's called gluconeogenesis. So if I need glucose, my body can produce it, even if I don't eat any carbohydrates at all. So you don't need to eat carbohydrates. So let's talk about cholesterol. When you eat in the carnivore way, you can expect to lower your triglycerides, but you also can expect to raise your HDL, your good cholesterol. That is called insulin sensitivity, and it's a good place to be. Insulin resistance is defined as having a low HDL and high triglycerides. That is a bad place to be. You can also expect on the carnivore diet to have a slightly raised LDL cholesterol. That is the so-called bad cholesterol. But let me put it into perspective. There was a study done. It was called the Women's Health Initiative, with 28,000 women over a 10-year period. And they looked at risk factors for heart disease. And they discovered the risk factors. The first risk factor was type 2 diabetes or diabetes with a 10.7 risk factor. Then it was metabolic syndrome, the circumference around the waist divided by your height. If you stand upright, it should be 0.5. If it's more than 0.5, you are metabolically ill. They call it metabolic syndrome. It includes hypertension, includes a low HDL and high triglycerides, as well as high glucose levels. Metabolic syndrome has a 6.0 risk factor for heart disease. Then we get hypertension. It has a 4.5 risk factor. And Then we have obesity, 3.9 risk factor, smoking as a 3.7 risk factor, and high triglycerides as a 2.1 risk factor. The lowest risk factor of all was LDL at 1.6 risk factor for heart disease. So if you have high triglycerides, you double your risk for heart disease than a person that has a raised LDL or a higher LDL. If you have hypertension, you have 4 times higher risk for heart disease than a person with high LDL. If you are diabetic, you have a 10 times higher risk than somebody with high LDL. And if you have metabolic syndrome, you have a 6 times higher risk than somebody who has high LDL. So if your doctor tells you your LDL levels is the only thing that is important and it's the main thing that we have to sort out, you should really reconsider that opinion, because it is not the truth. So it's all about the risk factors. Of course, 1.6 risk factor, it is a risk factor. But what is the highest risk factor? All the things that I've just mentioned that we are reversing with the carnivore diet. We are reversing type 2 diabetes, hypertension, metabolic syndrome, obesity, and high triglyceride levels with the carnivore diet. If your doctor tells you your total cholesterol is too high, you should also be skeptical about that commentary, because total cholesterol is really no factor. Dr. Candy Barry, who is a 4-year carnivore, is proud of the fact that his total cholesterol is 350, which is quite high. Cholesterol plays a vital role in the body. 30% of your body's cholesterol are within the brain. Your cell membranes are made with cholesterol. Your hormones are made from cholesterol. Your nerves are sheathed with myelin that is formed from cholesterol. Your immune system is enhanced with cholesterol. So if you want to take cholesterol medicine, you should really think twice about it. Discuss it with your doctor. But will it really prolong your life? But what can really prolong your life is if you can get rid of your metabolic syndrome, your high triglyceride levels, and your type 2 diabetes, if you have it. Many people are pre-diabetic and they don't realize that they will become diabetic. They measure their glucose at their doctor, and their doctors say no, they are below 6.5, but they are maybe 5.6. They are pre-diabetic and they still get damage, but nobody say anything until medicine is needed. In video 81 on my blog, Dr. Candy Barry showed that the CAC score, the calcium coronary calcification score, improve on the carnivore diet. You can improve your calcification, damage of the coronary arteries when you do the carnivore diet. So when you experience high levels of glucose in your blood, it causes inflammation on the arterial wall. Later on, cholesterol will come and patch up the inflammation. But after a while, the cholesterol is not effective to cover the inflammation, and the body starts a calcification process. This can be measured with a CT scan. It's called the coronary artery calcification score. And Dr. Barry say in video number 81 on my blog that people with the carnivore diet actually reverse the damage that was caused by the glucose when they go on the carnivore diet.